Camden Clark Medical Center. Our topic tonight has been on the recent changes at Camden Clark and our relationship with WVU Medicine. We have reached the part of the show where I will ask the questions that have been collected by our representatives this evening. And joining me to answer your questions are Dr. Christopher Kalinda, President and CEO of WVU Medicine, and also Dave McClure, President and CEO of WVU Medicine, Camden Clark Medical Center. Well, we've had lots of questions called in. We've talked about a lot. There were some things we didn't get to, so we're going to jump right in. This first question is from Sarah in Williamstown, and she's asking about the primary care groups within our area that are affiliating with Camden Clark Medical Center. And the question is, if a patient is sick, are they now going to be referred directly to Camden Clark?
Well, let me try to get to that answer in a way that we are thinking about it. WVU Medicine now is building out what we call a community physician division within its organizational structure, because we believe that primary care and community-based specialty care is an anchor, is a fundamental anchor and foundation for the system. And so we're looking at primary care practices with folks who are either going to become part of WVU Medicine or be strongly aligned with WVU Medicine moving forward, in order to ensure that patients can access those primary care services and those community-based specialty care services that are important to maintain their health and well-being. There are a variety of relationships that can and will evolve over time, and I know that Dave and his team are looking at those actively. In terms of where a patient who might get sick and might need hospitalization, we believe that Camden offers the best services for inpatient hospitalization, and we would hope that patients would see that and would be, while being sick is never fun, that they would look at that as their first choice in terms of getting the types of care that they deserve to receive in this region.
Okay. All right, let's move on. This next question is from Brad in Parkersburg, and the question is, will CCMC lose its local commitment to Parkersburg with the new WVU Medicine affiliation?
Absolutely not. I mean, I can say that emphatically. We are the community hospital, and we service not only Parkersburg, but we service an 8-county region around us. We are the rural referral center for many of the critical access hospitals, the rural clinics, the federally qualified clinics, and throughout West Virginia and the eastern portion of Ohio. And so we will continue to be the nidus of healthcare here in the Mid-Ohio Valley. The relationship with WVU Medicine is really to strengthen our relationship in the community, not to weaken that.
And let me add to that. Healthcare is local, and most healthcare delivered in the United States is local. The opportunity to partner with being a member of the WVU Medicine means that if higher level specialty care services are needed, that you have a partner in that, and that patients can see that continuum go from local community care to tertiary and quaternary care, and then back to community care in a seamless way that is much less burdensome than what currently can occur when you transfer patients from hospital A to hospital B. But let me underscore, WVU Medicine is committed to community health, community needs assessments, and to deliver the high-quality primary and community-based specialty care that's necessary for a healthy community.
Okay. All right, this next call is also from Parkersburg, and the question is, now able to receive the same care at CCMC as you would receive at WVU Morgantown or Cleveland Clinic? I guess the question is, is that comparable now?
Well, I'll answer that with our affiliation with the Cancer Institute. As you well know, the affiliation with the Cancer Institute has now brought new technology to our community. As you mentioned, there are some very, very specialized care plans that would have to occur at the university setting but many of the care that's provided at the university setting is now being provided here in the community. And the university physicians will be supporting the care here in the community too. So it's a two-way street. It's not only the care and the protocols and the services that are being developed at the university and available here in the community, but it's those same physicians that are at the university that are able to provide that care in the community too.
And we've had a history of this, pediatric neurology, pediatric cardiology. We're looking at forming our emergency department, having a cadre of all of our hospitals having served by physicians who are in our Department of Emergency Medicine. That's evolution. So it is a two-way street, as Dave said. With regards to the tertiary and quaternary care services that are found at Ruby, we're continuing to grow them. That's a work in progress. So there may be things that we can't do at Ruby, but if we can't do them at Ruby, we want to be able to help coordinate that care wherever that patient might need to go. But over time, WVU will be a nationally recognized academic medical center in Morgantown, because that's the direction we want to go, and we believe that helps serve all of the communities in West Virginia.
Okay.
Another prime example, as Dr. Clinton mentioned, that Women's and Children's Services at the university is a signature service line. Most recently, we have partnered with WVU to have pediatricians in the hospital starting next year. We have more than 1,400 deliveries a year in our obstetrical unit, and we are the only obstetrical unit on the West Virginia side, in a very large service area. And so many of the mothers come from the remote counties around us, and for that reason, we felt that it was important to have university physicians in our hospital caring for those newborns and the pediatric patients that are admitted. There's always the fear that is the university physicians going to take over, the patient care for our local physicians. This is a program that is really neat. I mean, I have to say that our local pediatricians reached out to the university and said, we really want to elevate our inpatient pediatric and newborn care, and will you help us do that? And the university opened their arms and said, absolutely. Let's partner with you so that you can provide the care in your office in an outpatient setting or in the remote rural settings. But while the newborn is in the hospital, or the young child that needs to be admitted for an illness or an injury, there'll be university pediatricians here in our community caring for them in the hospital. Okay. So yet another connection to the university where we're bringing high quality, comprehensive care to the community from the university setting.
Okay. All right. Well, this next question goes right into this, and we're quickly running out of time. I think we have just maybe about a minute to answer this one. This is from Tammy in St. Mary's, and she says, can I get a WVU doctor to treat me as my physician if I go through Camden? And you kind of answered that. So yes. there is a flow back and forth.
Absolutely.
And we'll probably be seeing that more.
Absolutely. And the relationship between our local physicians and the university physicians is a very important relationship. It is so easy for a local physician to pick up the phone and know the physician on the other end of the line who they're talking to, have a good conversation, and so that the care really does become seamless. And reverse, when the patient would go to the university, be cared for, and have to come back to the community, again, it's another opportunity for a relationship of picking up the phone and saying, Mrs. So-and-so is on her way back to your community. This is what I did for her, and now you can continue that care.
And okay. It's all in the same medical record.
Yes.
Okay. That's very important. We are running out of time. I'm so sorry. Thank you so much for spending your evening here. I appreciate it, Mr. McClure, Dr. Clinda.
Thank you.
Thank you so much.
Thank you.
Okay, on behalf of WVU Medicine, Camden Clark Medical Center, I want to thank you all for watching this special edition of Community Health Forum. If you called a question and we didn't get to it tonight and your contact information was provided, we will try to get back to you. If not, thank you again for watching. We really appreciate it. Good night. Take care.